MBBS students who are sitting over here, they may be having a small short note in their examination. So what is National Diabetes Control Program? So I will request you to listen carefully also. So these are the people who have supported us during this venture. And the question that I have to address, I have been asked that is how can a primary care physician is physician who is sitting in the district hospitals or district hospital or even the community health centers also. How can you involve? Hepatitis C is basically the super specialty, but our physicians they also treat it. So how to involve them into this program? And where does we stand as of now, achieving the viral hepatitis elimination in the country? That is something the national viral hepatitis control program, and there are many questions also. I will take my one. What you want to eliminate the viral hepatitis? I think you want to eliminate tuberculosis. You want to eliminate the leprosy also. You want to eliminate HIV and malaria. So my viral hepatitis, if you look at it, you will see the mortality is decreasing in all diseases. Tuberculosis, HIV, and the malaria. You can see the graph is going down. But for the hepatitis, it is going up. You can see this. This purple line. And I have the pointer. And most importantly, there are three, four types of the hepatitis A and B, which is caused by the water pollution. But these two, they are like a percutaneous blood or the sexual loop injections also, and they become chronic, and you will see the 96% of the death because of the viral hepatitis is because of this. So that's why we have to treat, we have to eliminate this hepatitis from our country. And if you look at the prevalence, when I'm saying the prevalence, I'm talking about the population of the India about 1.4 billion, and if it is 1.7%, it comes to 223.8 million, meaning 238 lakhs. Coming again to the hepatitis C, which is quite sensitive, I told you less than 1% for the national. In Punjab, it was 3.6. If you go to the northeast, it's further rising. So this is the thing, and here we have 5.5 million people to be treated. And WHO has the targets, as all programs have, even the two countries, they have target by 2030. Our Prime Minister saying that we should eliminate by 2025. And here are the targets also that new infection by 2030 should be reduced by 90%, and HPV-SC related tests reduced by 65%, and those diagnosed, 80% of them should be treated. That is the one thing. I'm coming back to the Punjab model. I have already told you 3 crore की आबादी है, prevalence 3.6%, and you have to treat 7.56 lakhs of people who are viral. There are 22 district hospitals, 3 government hepatitis C workshop. We have taken 120 primary care physicians from the district hospital. 4 घंटे की हमने वर्कशॉप करी और उनको वायरस के बारे में बताया, उनको डायग्नोसिस के बारे में बताया गया और उनका ट्रीटमेंट क्या होना चाहिए बताया गया. There was a before that, the treatment of the but from the June of 2016, the availability of the oral antivirals means you just give one or two tablets for 12 weeks, and that's all for the cure of hepatitis. So it becomes very easy to introduce this program, and that's what we discussed in this hepatitis C workshop attended by 120 primary care physicians or the medical specialists, and we did the agro program, the expansion of the community health outcome program. Here we took the help of my friend Dr. Sanjeev Arora from the University of New Mexico. And what we can do, this is something happens both model. I'll tell you. Yeah. So from my side, from the PGI of the hub, under 20 or 80, 70 who are attending, they are the sports. We talk to each other, talk to about the difficult cases, and we do the didactic lectures also. And on this hub and spoke model, we were doing on every 11 and 1 o'clock. And the other people like district epidemiologists, pharmacists, data management operator, and the monitoring and the evaluation was also going on simultaneously. Monitoring and the evaluation is the most important part of this such programs. उसे पता चलता है कि आपके सामने टारगेट क्या था, आप कैसे उसको अचीव कर रहे हैं, and how much you have achieved and how much is left also. It was done by the Clinton Health Access Initiative. Initially, I told you that we started with the 25 centers, and later on you see 2019 onwards to the 2021 rose up to 67. We included the central prisons also, sub-district hospitals also, ERT centers and the OST center. And you know what is the effectiveness of this model. I tell you this thing. This is the first publication. I'm telling you, in PGI we used to treat 1400 or 1500 patients per year. After introducing this program in the video or nowadays, I did not repeat over here. At that time, it was non-cirrhotic and cirrhotic based also, genotype based also. So, possibility, declatosphere, and the latinosphere, all these things were there, you know, all the. And this is the results that is published in the Journal of the Hepatology, and that gave the fame to the Punjab model also across the world. The people have called us from Europe as well as from the USA also. And you can see the effective rate 92%. And we think the best in the world. These and what we have uh, concluded that this decentralized care of a hepatitis C with a generic DEs. ये generic DE तो बहुत सस्ते में थे. I'll give you an example. Sulfasalazine, when it was introduced, it was $1,000 per tablet, and you have to give the 84,000, 84 tablet, $84,000. But India started making the generic, and nowadays the cost of the sulfasalazine is less than 50 rupees. You can understand actually. So similarly, we have the experience in the pediatrics children suffering from the hepatitis C, 98 to the 100% success rate. And if patient who injects drugs, those who are injecting drugs, they are prone to develop three infections. One is HIV, another is the hepatitis B and hepatitis. So it is very, very important. Even if you treat, they relapse and they get the reinfection also. So what we have shown over here, those who have completed the treatment, they received 92% of the success rate. And the most important, for a person who's already developed the cirrhosis and having the decompensated cirrhosis in the form of developing the ascites, bleeding, variceal bleeding, and hepatic encephalopathy, if you treat them, what will happen? Common sense dictates that the process would reverse. And it actually happened. What we call is the recompensation of the chronic hepatitis C related decompensated cirrhosis. Decompensated cirrhosis, वापिस गए, compensated हुआ, we could avoid the complication, we could avoid the liver transplantation, and the number of such persons are 25. And there are markers that predict who is going to achieve the recompensation. So SPR12, that is the treatment, in assimilated decompensation led to recompensation. I think we should have at the combination level also. And was coming, one of the migrant put up, is that you are very one of the most respected and very good medical college. हमें तो समझ क्या था, तो उन्होंने हमसे ये बताया कि जिस मेडिकल कॉलेज में जा रहे हैं वहाँ का जो डिसिप्लिन है बहुत अच्छा है। वहाँ के बच्चे जो हैं गप्पे नहीं मारते हैं, बाहर फिजूल में नहीं घूमते हैं, क्लासेस में बैठ के पढ़ाई करते हैं। दैट इज एडमिनिस्ट्रेशन, सो आई फील वेरी हैप्पी। अगर आप इस तरीके के प्रोग्राम करेंगे तो ये आई विल से पब्लिक हेल्थ प्रोग्राम से तो सोसाइटी को बेनिफिट होगा। ये प्रोग्राम इतना सक्सेस हुआ in 2018 July, on the day of the World Hepatitis Day, it was adopted by the central government as a national viral hepatitis control program. अमिताभ बच्चन भी इसमें शरीक हुए और इसकी जो है हमने स्टैंडर्ड ऑपरेटिंग प्रोसीजर यानी कि जो वो बनाया। I was basically the chairman of this NBSCB program. So we made diagnosis and management of hepatitis, diagnosis of hepatitis B. तो ये सारा चला उसके बाद में, and we have simplified the algorithm. What we have planned again. Cirrhosis, soft DAGLA, no sorry, non-cirrhotic soft DAGLA and non-cirrhotic soft well. और cirrhosis कैसे पता करनी है? तो स्कोर है, एवरेज स्कोर है, पे 4 है। So easy for every physician sitting in the district hospital, sub-district hospital, community health center, वो उसको देख कर ट्रीट कर सकता है। And आज तक की क्या है? What is the present situation? Is one of the article published in Journal of Hepatology. You can see over there on the left side. The treatment number is rising, and here you can see here over the last 10 years, 1.7 million people living with hepatitis C they were treated also, and it is further rising. And if you see that the four countries over here, they are Egypt, Pakistan, United States, and European Union. They contributed two-thirds of the people who have been treated. Lagging far, actually, barabar hai European Union. And the exact figure I am telling you from this data that we have treated so far 0.7 lakh centers in Punjab. Across the India, there are 1153 centers now from 711 districts also, and we are training 4,900 master trainers for treating such thing. And so far, we have treated 1.3 lakhs for happy and 4.4 for this. The next question, हमारे पास में क्या issues है? Challenges क्या? Many do. No, hepatitis C is a silent disease. It is not that everybody has a fever, fatigue, or anything. Absolutely fine. And when first diagnosis is made, the patient comes to you in decompensation by the silence one, and at that time it is too far, too late. So you can identify the people who are at heights. For example, people living with HIV who inject drug, who are on hemodialysis, prison inmates, and high risk sexual behavior, men having sex with men. All these they are the highest, but they constitute only 12%. What happens to 88%? So you have to have the different strategies to diagnose them, to pick up them those people so that you can treat. Otherwise, they will remain asymptomatic and may present to you in the advanced stage of the cirrhosis or including the decompensation. So I tell you, the risk factors to them. The most important unsafe multiple injection. हमारे यहाँ को होते थे पंजाब में तो बड़ा कॉमन था। किसी को बुखार हुआ चलो इंजेक्शन लगाओ, किसी को पेन हुआ कि चलो इंजेक्शन लगाओ। उनका ये था कि इंजेक्शन लगा देंगे तो 100 गोली के बराबर है, but these are the myths actually. They have led to all these catastrophic events. How to improve early diagnosis and linkage with the care in the community? This is the main challenge actually. We are working on it. एक तो यही है कि सेल्फ क्वेश्चनर्स होते हैं कि एक में 27 थे, कोई 72 थे, रिस्क फैक्टर उन्होंने ढूंढे, उसमें से कुछ भी था, जैसे कि पहले कभी इंजेक्शन लगाया कुछ और था, तो उसमें दे कैन डायग्नोस, बट नाउअडेज most important self testing device has come, that is the strategy 2. ये क्या है कि आप सलाइवा से इसमें रखिए, if you are positive anti-SCV तो ये उसमें आ जाता है, एक्यूरेसी 98% है, but we have our initial experience also, overall acceptability is 71%. इसमें पेशेंट को डॉक्टर की जरूरत नहीं है, ये दिया जाए और वो उसको अपने से सेल्फ टेस्टिंग एट होम कर सकता है. सेंसिटिविटी, स्पेसिफिसिटी, पॉजिटिव प्रिडिक्टिव